The Waste Management and Decontamination Issues module deals with two sections. The Waste Management section is concerned with the disposal of healthcare risk and non-risk waste, and the handling of sharp items like needles. The Decontamination section is concerned with environmental and equipment cleanliness, the correct management of body fluid and blood spills, and the correct handling of used linen. Waste management is concerned with the disposal of non-risk and risk waste, and the handling of sharp items. It sets out best practice in international standard precautions for infection prevention and control. The DVD contains 4 core modules, like needles. Decontamination issues focuses on environmental and equipment cleanliness, and the correct management of body fluid and blood spill.
A hospital's environmental services staff are critical players when it comes to preventing infections. Hand hygiene is the single most important step you can take to prevent the spread of disease. Personal protective equipment, or PPE, reduce the risk of exposure to germs. This includes gloves, gowns, masks, and eye goggles. If a patient has a disease spread by airborne germs, keep the patient's room door closed and wear a special mask, also called a respirator, provided by the hospital. Proper cleaning and disinfection can prevent the spread of germs. Disinfect whenever an area has a high concentration of dangerous germs and the possibility they will be spread to others. Thorough scrubbing is necessary for all environmental surfaces being cleaned in patient care areas. Following good infection control practices protects patients and hospital workers. Remember to always follow these basic rules of infection control.
OSHA requires that equipment and surfaces be cleaned and disinfected after contact with blood or other potentially infectious materials. This should be done according to the employer's exposure control plan. Locate and open a bloodborne pathogen spill cleanup kit. Put on appropriate protective clothing, including disposable aprons, caps, and eye protection. Wear double gloves. Pour the absorbent material over the spill. Use a scoop to pick up the material. Place all cleanup supplies, including protective body clothing, into a red bag for proper disposal. Apply a disinfectant to the area immediately or as soon as feasible. Thoroughly wash your hands. To decontaminate the area, apply an appropriate disinfectant, such as a fresh solution of diluted household bleach. Dilute 1/4 cup of household bleach into 1 gallon of cool water. The contact time for bleach is generally considered to be the time it takes the product to air dry.